Hi, everyone, and welcome to today's webinar, Connecting Communities and Schools. I am Tremise Carter. I am the Youth Relations and Organizational Equity Manager at Wholespire. In my role, I also provide staff support to the South Carolina Schools Network. The mission of the South Carolina Schools Network is to identify and promote healthy eating and active living strategies in South Carolina public schools that empower key stakeholders and encourage collaboration among those seeking to improve student health and academic achievement. We achieve this through coordinating state-level partners to advance healthy eating and active living in the school settings. We are building capacity at the state and local level to advance effective healthy eating and active living strategies in schools. We are identifying, coordinating, and promoting healthy eating and active living resources and programs across the state, and sharing healthy eating and active living best practices and successful initiatives. The Schools Network has been staffed by Wholespire since its reconvening in 2012.
Hey everyone, I'm Erica Ayers. I'm the school wellness consultant with the Division of Nutrition, Physical Activity, and Obesity Prevention at DHEC. And I also serve as the Executive Director for the South Carolina Governor's Council on Physical Fitness. The Governor's Council, The Governor's Council has been around since the 70s, and it was established by an executive order by the governor at the time. So bonus points if you know who the governor of South Carolina was in 1972. You can put that in the chat. The mission of the Governor's Council is to serve the state by promoting health and well-being of South Carolinians by advancing physical activity. And the council is currently focused on efforts that support student health, which is why they now meet jointly with the schools network. And now Tremise is going to share some more about this collaboration.
So in 2020, the Governor's Council on Physical Fitness and the Schools Network began to consider our similar priorities and our overlap in membership. The two groups decided that it would be best to meet jointly. Through our joint efforts, we support access to healthy foods and opportunities for physical activity to improve the health of South Carolina students by staying informed, sharing with each other, and sharing with others. The purpose of today's webinar is to enhance collaboration between schools and communities using the whole school, whole community, whole child model as a framework to support student health. Today's agenda includes a discussion of the problem and solution, learning more about working with communities and schools, a Q&A, and a call to action. So we want to learn more about who is on the webinar with us. Would you please tell us which of these best represent you? A state, agency, organization, community coalition or organization, school district, or other? So it looks like we have a pretty good mix on our call, a pretty good balance as well between state agency organizations, community coalitions, school districts, and other. And we'll see through the names and your organizations that you enter sort of where these other folks fall in their categories. So thank you for completing that poll.
All right, so before we get started into our panel, I just want to provide a little bit of context. And so first we're going to look at the data. So technically, what's the problem? And what we know based on this data is that students' health is not where it should be. We know that school-age children and youth should be receiving at least 60 minutes a day of physical activity to achieve optimal health. But unfortunately, based on what we know from the data we have provided, only a quarter of South Carolina high school students are meeting this recommendation. We also know, thanks to South Carolina Fitnessgram, that 1 in 3 South Carolina students are overweight or obese, and half of South Carolina students do not have good cardiorespiratory fitness, meaning that their hearts and lungs do not function at a capacity important for sustaining health. We also know from our South Carolina Fitnessgram data that African American females have the lowest rates of meeting health-related fitness standards, and students living in poverty have lower rates of fitness than those not living in poverty. And what we can tell you is that these children and youth are at a greater risk of developing lifelong chronic illnesses such as diabetes, hypertension, and cardiovascular disease. They're also more likely to become adults who are overweight or obese, which greatly increases the risk of developing chronic illnesses. So this is what we have so far, the most recent data on overweight obesity for South Carolina, and it's currently at 36.2%. And you can see how that's also stratified by race and ethnicity. And that's why we thought it was important to share this information with you, because it is a continuous trend. And then also share what's an evidence-based proven practice solution to addressing this data. And that would be the whole school, whole community, whole child model. We address this data, we help our children and our youth receive equitable opportunities to be healthy and successful by working together. And the WSCC model does this because it provides a framework for greater collaboration between schools and communities across multiple sectors. It places the child at the center and takes a comprehensive approach to support health and learning. And now what I'm going to do is show you a brief 2-minute video that's going to provide an excellent overview on what the WSCC model is. So bear with me while I share. And Tremaine, if you can give me a
For too long, health and well-being have been put into a silo, kept both logistically and philosophically separate from education and learning. Yet we know that both health and education affect individuals and society, as well as the economy. Health and education must work together whenever possible, and schools are a perfect setting for this collaboration. In 2013, ASCD and the U.S. Centers for Disease Control and Prevention convened a group of leaders to strengthen a unified and collaborative approach to learning and health. The result is the whole school, whole community, whole child model. This new model combines and builds on elements of the traditional coordinated school health model and ASCD's Whole Child initiative. It responds to the call for greater alignment, integration, and collaboration between health and education. The model expands the components to 10, placing greater emphasis on the psychosocial and physical environment and highlighting the ever-increasing expanded roles that community agencies and families must play. The new model also outlines how the school, staff, and students are part of the local community. While the school may be a hub, it remains a focal reflection of its community. The components surround the tenets of a whole child approach to education, those that ensure that each child is healthy, safe, engaged, supported, and challenged. Finally, the new model returns attention to the ultimate focus of the two sectors, the child. Join us in ensuring a collaborative approach to learning and health for each child, in each school, and in each community.
Okay, so now you may be wondering, that's great, Erica, but what does that actually look like in South Carolina? What are some examples? And that's exactly what we wanted to put this panel presentation for, to show you those examples. So, Tremise, I'm going to hand it back over to you to get us started with the panel portion.
I'd like to welcome everybody who has actually come to campus to view this, and everybody who's viewing it virtually. Thank you very much for taking time on your busy.
I don't know what that was about. Let me make sure I close my YouTube. So hold on.
Right. Well, as she's getting ready to share the slides, I will begin to introduce our panelists. We have Steph Shelby, who will be a panelist, and he is the program manager at the Alliance for a Healthier Generation. We have Lisa Curtis, who is a health and physical education coordinator at Richland School District 1. Darlene Lynch, who is the Director of Community Health Transformation at the South Carolina Office of Rural Health, and Kelsey Sanders, who is the Community Initiatives Manager at Wholespire. So Darlene and Kelsey are going to get us started, but before they get us started, we have one more poll question. It's an open-ended question. How do you currently connect with your community? So I'm going to share that poll now. And take a second to let us know how you're currently connecting with your community. I'm going to give you a few more seconds to answer that, being that that was an open-ended question. How are you currently connecting with your community? So let's look at some of our responses. Some people said they're volunteering, others said involvement in coalitions and committees through social media and printed materials about healthy habits. Some said, I help manage our telehealth education, electronic and face-to-face meetings as we recover from COVID. Let's see, helping schools handle COVID data and get back on track. Live Well Coalition, sharing resources through funding and training, connecting with my community to advocate for youth, very good. Monthly meetings, Facebook, email, door to door. So those are just some of our responses. I see in the chat, prevention services. So thank you all for sharing those with us. And now we will have Darlene and Kelsey tell us a little bit more about community involvement.
Sorry, y'all, my slides are for some reason moving in the wrong direction.
I guess I can get started now. We're on the right slide. So I want to start off with, on this slide, you see that it's community involvement, but I want to start off with the question of what is a coalition? A community coalition establishes and builds relationships within a community where better ideas and outcomes can be achieved together. The focus of these coalitions can be very focused or very broad. There are mental health coalitions, there are literacy coalitions, and there are coalitions who work on healthy eating and active living, or otherwise HEAL. Now, we have many coalitions that we work with throughout the state who are focusing on healthy eating and active living. Two programs and two types of coalitions that are throughout the state are Healthy People, Healthy Carolinas, and Wholespire. With Healthy People, Healthy Carolina, the Duke Endowment launched this program in 2015 to help communities in North Carolina and South Carolina address the root causes of chronic health issues such as obesity, diabetes, and heart disease. Healthy People, Healthy Carolina supports diverse community coalitions in their efforts to improve population health through the collective impact model and to enhance a community's capacity to implement evidence-based interventions. Where we work or go to school, how we spend our free time, whether we have access to fresh food, and whether we can exercise in safe environment, all determine our overall health and well-being. The coalitions participating in Healthy People, Healthy Carolina initiative are focused on improving access to healthy foods and physical activity. And I'm going to let Kelsey jump in so she can tell you a little bit about the Wholespire chapters.
Yeah, so coalitions are found all across the state, and they come in all shapes and sizes. And we are fortunate at Wholespire to be able to support 13 coalitions across the state in a number of counties. I won't name them off, but we'll see a map in a moment that kind of shares just some of the coalitions around the state. Wholespire chapters are working to address access to healthy choices, including healthy eating and active living, but they can also be expanded to other things as well.
Kelsey and Darlene, can you tell us where community coalitions are across the state?
Sure, yeah. So on this map, there's a lot of different colors and shading going on. So don't worry a ton about that, but really this map is just to indicate that there's a lot going on in our state. We have coalitions in most all communities. The shading indicates different funding sources that are in that community that are kind of keeping the coalition going. But the good news is that there is a lot going on in our state, and we're very fortunate in South Carolina to have a lot of organizations who invest in community coalitions and building their capacity. So those are organizations like the Office of Rural Health and Wholespire, but also DHEC's regional staff, South Carolina Hospital Association, and even SNAP-Ed implementing agencies work to be a part of coalitions and build their capacity. So I wanted to give, Darlene and I wanted to give a few examples of maybe the types of work that coalitions are doing, so you can kind of get an idea of how it might complement or fit in with schools and the work that they might be doing to improve the health of school environments as well. So I'm going to give two examples, and then I'll let Darlene share a couple as well. But the first one I wanted to give is that many coalitions in South Carolina are implementing a program called Food Share. And that's where community members can purchase a box of produce for $20. The produce is regionally sourced. And the really cool thing about this program, if you're not familiar, is that SNAP recipients can also use their benefits and actually purchase the box for only $10 of their SNAP benefits. And that is made possible through a program called Healthy Bucks. And while schools work to address food insecurity during and sometimes even after school and after school programs, they are addressing food security in that sector. Community coalitions are often addressing the gaps in food security for children and families through programs like Food Share. Another example that I'll give as well has to do with addressing physical activity access. So again, schools play a very vital role in physical activity in students and in children in communities. And so while they are investing in providing physical education and teaching children the basics of being active through exercise, sports, dance, other activities, community coalitions can provide support to that effort by helping to make sure that play and physical activity is actually accessible once they leave the school itself. So just a little example to give, let's say that there's a student who through their PE classes learns about the sport of soccer and just falls in love with it. They love it, and they go home from school, they tell their family, and they ask their parent or guardian, you know, I learned about soccer and I want to go across the street to play at the park and play soccer. And let's say their mom says, no, you cannot go across the street because it's not safe to cross the street where we live. And that is an opportunity, that is an example of where a community coalition could be mobilized to address that issue of access. So you can kind of see how what is happening within the school walls around physical education and physical activity, as well as healthy eating, is very much supported by the community coalition work. And at the very least, they're very complementary work that's happening by community coalitions and also in the school setting as well. So I'm going to give Darlene a chance to share any examples that she might want to at this time. Darlene, can you hear me? Can you hear us, Darlene? Sorry.
I think Darlene may be frozen.
Yeah.
Not sure. So, oh, are you back, Darlene? Can you hear us now?
Yes, thank you. I got kicked
Perfect.
off the whole thing, so
Oh, no.
I'm glad it came right back on. So just to give you a couple of examples, and mine are more related to what they are focusing on right now, but they want to be able to focus on things that are happening within the schools. So just to let you know how physical activity is being focused with the communities with Healthy People, Healthy Carolina. They have this program that they're working with the schools right now. It's called Active ED Walkabouts. And this is a web-based program that incorporates physical activity into math and language lessons for pre-K and second grade. So this is what they're already doing, but what they would love to do is to get involved with other activities that the schools are doing, because they really want to help and work with children. They have targeted youth as one of their targeted markets in order to help with physical activity. Another one is they're very involved in built environment approaches to improving physical activity. And what that means is they work to create safe and accessible spaces for children and adults to be physically active. So that's some of their focus areas that go hand in hand with some of what the work the schools are trying to get done. So they will be perfect to work with.
Okay, now I think Termise might be frozen. So we can go to the next slide and I'll share some of why schools and coalitions we think should work together and what's the benefit of that. So one of those reasons is that schools and community coalitions, like Darlene mentioned, they can gather for a bunch of reasons, but often they're gathering to address the issue of health and maybe even specifically healthy eating and active living. And so there is this sort of shared mission. They might not have the exact same mission statements, but there's a good deal of overlap. And community coalitions are working towards improving health for the community as a whole, and students and also the staff, the admin, everyone in a school setting, they're part of the community. So it really is, it is a shared mission to want long, healthy lives and success for everyone in the community, including students and people in the school setting. And in addition to that, I would say it's also mutually beneficial. It's an opportunity to share resources. So for school staff and admin that are working to address the health of their students, to you all that are on this webinar today, I would say there's no reason for you to feel like you're doing that alone, because you're not. There are other people in the community, even if you haven't had the opportunity yet to meet them or work with them, who have that same mission, that same passion as you, and who are maybe addressing it in a different setting. So helping a coalition understand sort of what you're working on in a school setting so that they can just support you in the work that you're doing, and vice versa. So if you're here as a community member or a coalition member, I would encourage you to find the right contact at a school, and we can help you kind of make those connections if that's where you're at. To share the work that you're doing in the community so that we can all be aware and have the opportunity to elevate the work of each other. And I'll say too that each of the coalitions that that are in our communities, they're a network in and of themselves, but also each of the people that participate in those coalitions often represent an organization that could potentially be a great partner to a school. So you never know where even an unlikely partnership, so maybe it's somebody who represents a hospital system or a clinic, maybe it's somebody who represents the faith-based setting or libraries. These are the types of representatives that we see in coalitions, and they could be potential partners for the work that you're doing as we take a more holistic approach to health and wellness. And lastly, I'm going to say this several times on our slides, but for the school staff that are on these calls that are working to create healthier school environments, please let these coalitions be natural champions for your work. I think Darlene was the one who coined that term, and I think it's so perfect because this really is the work that community coalitions are also trying to do in the community setting. So let them know what you're doing so that they can carry that same message out into the community. If you're trying to change a fundraising policy to only allow healthy fundraising policies or healthy fundraisers in your school, instead of working on that by yourself, let your coalition know in your community that you're doing that, so that when your community coalition members run into somebody and it's somebody who maybe is resisting that change, they can again be a voice for, I actually think that's a great idea, and here's why I support that. And they can just become again a voice for the work that you're doing and a champion for the work that you're doing in the school setting.
But yeah, can you tell us a little bit more about how a coalition can help a district or a school?
Sure. So again, this is some of what was on the previous slide, but just to reiterate, I do think if you're on this webinar and you're a coalition member, these are things to be thinking about. If it's not clear how you could support a school, here are some of the ways that we think you could do that if you're not already. And then for the school staff and people representing schools here today, I would say just to encourage you to reach out to them to see that, again, these are people who can carry the message of the work that you're doing within the schools and just really be a voice for that in other settings. And so you don't have to do it alone. You don't always have to be the one saying, no, we really do want to open up the school grounds to community members. We really think it's for the good of the community. And if you get resistance, you'll have someone else to say, well, we agree, we stand with them on this. It's also, again, an opportunity for coalition members to mobilize and address issues of community access. School staff, teachers are often sort of on that front lines. They hear issues. So if you're hearing repeatedly, man, a lot of my kids are coming in hungry after the weekend, I wish there was something we could do. We know you carry so much responsibility. So bring that to your coalition, bring some of those patterns that you're seeing to them, and let us all brainstorm together, collaborate of how we can address those issues. They can also very practically, community coalitions can serve as a volunteer pool for you. Just in the past few months, I know that coalition members have been a part of a school career day and volunteered in that sense. Coalition members are often the volunteers that pack those food share boxes that I mentioned earlier. They can come and volunteer to do a cooking demonstration in the classroom. They can come to a health fair that you're doing. So they're just bodies that, again, human beings who carry that same mission that want to be helpful to you. And then lastly, I'll say, hopefully, and I think this is true, we've seen this in many coalitions, that it's a place to be encouraged, to be around people who are thinking the way that you're thinking, and who, again, who are passionate about the things that you're passionate about and really just want the best for the community. So would just encourage those of you from the school setting just to know that that's a place where you can go and feel supported to try to make some of these changes in the school setting.
So how do you find out if there is a coalition in your community or an organization in your community? And once you find that out, who would you contact?
Yeah, so we have, like I said, and Darlene shared earlier, there's so much going on in our state with coalitions, and there's whatever county or community you're in, there's probably someone that either covers it or there's a coalition directly in that community. So just to make it simple, we would recommend that you go ahead and just reach out to Darlene or myself or both of us. And between the two of us, we can put you in contact with the right person to get that conversation and that collaboration going.
Thank you so much, Darlene and Kelsey. And now we will turn it over to Erica, who's going to introduce us to the part where we talk about schools in a little more detail.
Awesome. Thank you, guys. And thanks for that great information on the community part. So now we're going to flip the script. and talk about how school districts address student wellness and how community partners can get involved. So Teresa is going to open up our third and I believe our final poll. And we want you to answer this open-ended question on how do you currently connect with your school district? And we'll give y'all a little bit of time to respond to that.
We will give it a few more seconds. Yeah. Okay, so here are some of the results from that poll. Working with nurses on COVID data. So we see a lot of folks are involved with COVID information and COVID data. We recruited someone from the school district to join our coalition. We provide school supplies. Someone said, I'm based in a school, through school food service directors and Head Start Center directors, through a partnership with the school nurse consultant at DHEC. Schools, nurses, and admin staff. I serve on a health education advisory committee, transition meetings for children heading to kindergarten, emails and in person. I serve as a liaison for CDCF, through Spartanburg Health School Initiative, providing resources and partnership on holistic health. So as you see, there are many ways they have a representative on their board, many ways folks are working with schools. Thank you all for completing that poll.
Yeah, those are some awesome examples. Thank you. And so what we're going to do now is touch base on some of those things that y'all mentioned. I'm going to reintroduce Seth Shelby with the Alliance for Healthier Generation and Lisa Curtis with Richland School District 1. So welcome them for this part of their panel discussion. Now, Seth and Lisa, before y'all get started, I do have a question for y'all. When we're talking about schools and we're talking about school wellness, are there any policies or legislation that the school districts have to follow when it comes to addressing student wellness? Because I feel like this may be important for communities to know, like, what is it that schools have to do? And that could be a good place of where to start helping them.
Absolutely. So the Students' Health and Fitness Act of 2005, one of the sections in it says that each school district has to have a coordinated school health advisory council, otherwise called the CSHAC. And they help to assess, plan, implement, monitor the district and school health policies and programs. And they have to have a district wellness policy. And each district, in collaboration with the CSHAC, has to develop school health improvement plan that addresses strategies for improving student nutrition, health, physical activity, and includes a district wellness policy. So the cool thing about this is districts will post their district wellness policy on their website. And so a representative from a community organization can reach out to a school district and request to serve as a member of their CSHAC. So if you go to the next slide. There you go. So the district wellness policy guides the wellness initiatives for school. So if it should be posted on the website. And so you can see where your services might align to the district and school needs. and communication between the district, school leadership, and community organizations lead to healthy school partnerships. And this is powerful because if you are on the district wellness CSHAC, ideas and resources can be shared district-wide between all the schools. You could also reach out to a school and ask to be part of their school wellness team. And we'll talk about that in a minute.
So Lisa and Seth, so these are the state and federal legislation mandates that school districts have to follow. What are some of the resources that they're using, evidence-based resources, proven practices that they're using to meet these mandates?
There is a wealth of resources out there to help schools and districts as they navigate these policies. If you go ahead to the next slide. One of the most recent resources that we have available for districts free of charge in this state is actually from the organization that I work for, which is the Alliance for a Healthier Generation. And most districts have a lot of historical experience with our assessments and action planning and the virtual experience that we are able to provide on our platform. However, one of the things that we have done to enhance what we do is really to align our traditional assessments, primarily the Healthy Schools Program assessment, which was essentially directly from the School Health Index from the CDC. So it's an evidence-based framework that works towards continuous improvement and policy environment changes within schools and districts. And so the Thriving Schools Integrated Assessment, this is a new assessment that we're able to use. So historically speaking, that Healthy Schools assessment, that was really more healthy eating, active living, just primarily. So that revolved around policy and physical education, physical activities, smart snacks, nutritional environments, and employee wellness. And as you can tell from the topic areas listed here, this new assessment really focuses more holistically on the areas found on the whole school, whole community, whole child model. And so this integrated approach to school health that really puts the best thinking and guidance on how to keep students and staff and teachers, families, everybody in the school community healthy across 4 big dimensions. And that's mental health, social health, physical health, and equity and access. So the assessment and the data that it provides to districts, it can really help schools and districts work towards, again, that improvement in policy, system, and environmental changes. And those changes can really uplift district and community wellness profiles while also reducing inequities in the health outcomes that we see. And from a capacity standpoint, and this is what we're about to talk about, is how this can be accomplished really through a greater integration and alignment among our educational systems, our community coalition systems, cross-sector systems, to really support the total health of the school community through a shared journey. Next slide, please. So this is the framework that holds it all together. This is the evidence-based 6-step process from Healthier Generation. And this is really how the school journey takes place. When a school convenes its school wellness committee together, or even district wellness committee, they're really starting with all the same steps. They're going through the same process. And as a school and district does that, they are, of course, building out their wellness committee, which is so incredibly important. And really the purpose of this conversation today, to make sure that it is inclusive of the community that they represent. And so really building that support out. And of course, familiarizing themselves with the assessments, making sure that they really understand what it is they want to do with the data, and then take those assessment data points to go into developing action plans. We can't go anywhere unless we know where we've been. So really taking that data and using it meaningfully to create action plans. And this is not prescriptive. This is up to a district and a school to really decide on what it is their data is telling them and how they would like to use that data to move forward. And then again, exploring resources and taking action. This is really where those community coalition partnerships and that capacity enhancement component really take place. When you've got community coalition members at the table, and when you want to start talking about exploring resources, these folks are just incredibly helpful in terms of connecting you to resources that are already in existence and ready to hop at the opportunity to help. And then, of course, at the very end, making sure that we celebrate that success of every single year, every single school year, really celebrating the achievements, even if it's just one singular policy change, because that one singular policy change can have transformative ripple effects for years to come. Next slide.
Okay, so from the district, the CSHAC, each school should form a school wellness team. So the first step for the 6-step process in Healthier Generations is to build support. So who do you ask if you're at a school? Well, you start out by asking school staff. And you can see this graphic kind of shows the school wellness committee, all the people that are involved. But first I would start with school staff. I would classroom teachers, food service staff, PE and health teachers, administrators. The administrator can act as a liaison for communication between the wellness team and the school improvement council. So then you get buy-in from the school improvement council also. That you can ask school health professionals such as the school nurse or the school counselor. Definitely need to have parents involved, definitely need to have some students involved, and of course, community members. And a representative from a community organization, you could reach out to a school in your area and see if they have a school wellness team and ask if you could serve as a member. And most schools would be like, yes, please. So, that is something you can do. So once the schools have their wellness teams, what they do is they have someone take the Thriving Schools assessment, and they basically are looking to see where their school is right now. So they're answering questions to see, where they stand. And then they use that assessment data to choose at least one feasible initiative per year while maintaining their already successful programs. And they're starting their journey. They take that at least one feasible initiative and they create an action plan. And they say, okay, this is what we're going to work on this year. Then they explore the resources. Well, most of those resources probably could come from a community coalition. And Healthier Generation also has, on their website, they have plenty of resources too, but a local community coalition could provide for you. After that, you take action and then you celebrate success. And community partners are part of the process for transforming the whole school's climate to one that centers on health and wellness.
That's great. Can y'all provide some examples of what that school community partnership could look like, what those actions could be?
Absolutely. If we go to the next slide, I'll be able to talk about specific examples of what some of these partnerships can look like. One of the most profound parts of my experience as a program manager with Alliance for a Healthier Generation, after being in the educational system as a teacher for the last 5 years, has really been a broadening of my understanding of how much statewide and community resources are out there for schools that are really eager to work with schools and constantly communicate their desire to get involved. And sometimes it's as simple, and that's why the power of this presentation today hopefully can lead to greater communication and greater partnerships. But we wanted to put together just a few examples, and this is not a comprehensive list in terms of, this is a very small condensed version of what is actually out there. Every nook and cranny of the state, like was said earlier from Kelsey, typically has some sort of capacity available. And with a little bit of that investigation on behalf of schools and the communities and partners themselves, we can really start to bridge that partnership together. And as you can see on this list, it's very robust in the sense of what exactly these community partners are involved with. You have everything on here from tobacco prevention to school gardens, family engagement centers, community health workers, you name it. There's a lot of capacity out there, and a lot of it is cross-sector. And it's a really beautiful thing when all of these partners are coming out of their silos to work together in terms of improving school community health profiles. Next slide.
So do y'all have any suggestions on how the community coalitions can approach the school districts to get this conversation started?
Yeah, it really can vary based upon district to district and community to community. But one of the first things that they can do, and this is I'm talking directly to schools and districts, is, you know, once you have your data and you kind of know where your needs are, that is really going to allow you the opportunity to have a roadmap in terms of where it is you want to go. And that's something that Lisa and I talk about a lot in terms of this journey. So from the school and district side, an easy way to understand who it is you need to reach out to and where that capacity exists is simply just to get on the basic level of understanding where you're at, taking that assessment, really finding out where your gaps are, and then exploring the resources that are available to you. And that's as simple, sometimes connecting with people just like Darlene and Kelsey, and also reaching out to others. You know, the second you reach out to any community coalition and you say that you're from a school, I dare say they're going to be very eager to and excited to work with you. And this slide actually represents an example of partnership in action. And you know, this is an example of actually something that's actually going on in South Carolina right now with a particular school district. And essentially community partners were coming together actually to look at the inequities in some of this health outcome data. And they were saying to themselves, you know, we've got this district here that definitely has these inequities happening in terms of health outcomes, these fitness outcomes related to chronic health diseases. And they were saying to themselves, well, how can we really increase capacity? How can we increase support and really listen to the school and district in terms of what they need and really partner with them? And so what they did is essentially reached out and through very simple dialogue conversation, got themselves woven into the district wellness conversation. We're started to get invited to these district wellness meetings. And when that integration started to happen, that's when you really were able to do these really awesome and transformative resource mapping exercises and really creating a shared vision for where it is they want to go. And it's incredibly, you know, it makes me so happy. As you can tell when I'm talking about it, just brings a smile on my face, because that is such an important thing for schools and districts to realize is with all of the constraints and barriers that schools and districts face in terms of capacity, the second that integration really starts to happen, wonderful things start to happen. And not only that, there's a breath of fresh air in terms of not having to juggle all those things at once. As educators, they know very well about juggling things. And it's such a beautiful thing to see the community partnerships come in and help. And so what ended up happening was they created that shared vision and that mapping and action planning, and then actually found ways to integrate capacity onto each school wellness team. And these folks who are integrated onto these school wellness teams are really able to take the information, what's going on in those school wellness teams and the voice and the everything that's going on, and really applying it and finding the resources for the school. So now you have the teachers and the wellness leads who are involved with the school, not even having to do the heavy lifting of exploring and really getting the access. They're having that done for them.
All right, thank you, Seth and Lisa, for sharing that information about school districts and schools and how the communities can get involved. So looking at our time, we are at 4:21. So I say now we can open it up to questions, Tremise, if we have any. But while Tremise is filtering through the questions, Seth and Lisa, any final comments for your portion of the panel? All right, awesome.
One question that we received was to please name some school districts that may have a strong CSHAC that we can potentially model after.
Well, Lisa Curtis.
I was gonna say, we have one on the
would be, yeah, there's one I could think of for sure. Also some notable examples. I mean, there's some, I think a lot of people might think of larger school districts as having this, that's always going to be the model, but there's certainly some smaller school districts that encompass really strong school wellness models. And some of those that off the top of my mind that we are working with on various projects would be, Kershaw, Sumter, Spartanburg 5, Spartanburg 6, Lexington 1, Lexington 5. There's a lot of models out there that I think, can be great examples, but the key is really to not really look at someone else and then use that exactly. It's really just make it what it needs to be for you and where your needs are at, and let that be reflexive, because as long as you've got that inclusion, as long as you've got that representation from the community, student voice, parent voice, everyone involved, it's going to take care of itself, and it's going to be robust and do some really great things.
Thanks, Steph. And someone asked, will the PowerPoint be emailed out? We will be posting the recorded webinar following the webinar. And yes, we can share the slides with everyone, email those out as well. Another question, how can we access these various resources for our schools?
Seth, you want to take that one?
Yeah, for every school district and school across the state and across the country that's a public school, you have free access to Healthier Generation resources. By simply visiting the Healthier Generation website, you will be able to go to the Action Center and essentially get yourself registered, typically in less than 90 seconds. Just make sure that you are just going through the steps, making sure that you specify what you do with the school or the district. And from then on, you have access to all the resources and trainings that are available there. And they are very robust, very easy to navigate. The virtual platform is made intentionally to be very user-friendly. And so you can do everything from taking the assessments to action planning, exploring resources, doing trainings, professional developments. Everything's right there in that Action Center. So the best thing you can do is get registered and start playing around.
Seth, can community coalitions, community members join their school districts, their schools' Healthier Generation team online?
Yes, they can actually. Now, there is some limited access to certain resources and trainings when you're not directly employed by the school district, but you can still have access. You can still join that team. So yes, you can absolutely have access to that, to the Action Center, as long as you have, built that communication with the school or district, and they can send that invite to you very quickly.
We will take one or two more questions, and the questions that we don't get to, so if you have questions, please continue to add them to the chat. We will answer those when we send out a follow-up, so you will have responses to those. But one question is, have districts and schools integrated wellness efforts into their 5-year district strategic and school renewal plans?
I would say that depends on the district, but I know that many aspects of wellness are now in, for my district, definitely in our district strategic plans. So I would say it depends on your district.
And the last question we will answer is mental health incorporated. Sorry, another question came in. Is mental health incorporated? Sometimes behavioral changes are a reflection of the mental state.
Yes. So if you're talking primarily through the Thriving Schools Integrated Assessment, it's a major component. Again, so if you're looking historically at Healthier Generation assessments, the Healthy Schools program did not integrate mental health components. So this Thriving Schools Integrated Assessment is very robust. And yes, it covers mental health, physical health, social health, and then of course, equity and access, which, as we all know, is an incredibly important domain to make sure that we are assessing our own equity and access practices through all those domains as well. So it's a very robust assessment, and schools can take as much or as little of the assessment as they want. And so, yes, I definitely recommend, if you are involved with mental health resources and you want to get involved with the schools, definitely explore those Thriving Schools Integrated Assessment resources.
Thank you everyone for submitting your questions. Once again, sorry we can't get to all of them, but the questions have been recorded. And for those that we were not able to answer, we'll be sure to include a response to those questions in our follow-up. So as we prepare to end today's webinar, we do want to leave you all with a call to action. I'm sorry. The call to action is to find your community coalition or organization or your school district wellness committee. Reach out to find out the best contact and then schedule an introductory meeting. And if you remember from Kelsey and Darlene's presentation, they said feel free to contact them if you would like help making that connection with your community coalition contact or community organization contact. So that is our call to action for you, is to either find your community coalition organizational contact or the school district contact, and then reach out to schedule an introductory meeting. So thank you all for joining us. Thank you to our co-host and our panelists, and I hope you enjoy the rest of your day. Thanks.